You woke up feeling fine this morning. No chest pain, no dizziness, nothing dramatic. You made your coffee, sat down, and went about your day. But inside your arteries, the pressure has been dangerously elevated for months, possibly years, and your body never sent you a single alarm. That is the real danger of high blood pressure after 65. Not that it announces itself loudly, but that it doesn't announce itself at all. This is why hypertension earned its nickname, the silent killer, because the most serious damage it does to the heart, the brain, the kidneys, and the eyes happens quietly, incrementally, over years, while you feel completely normal. If you want clear, honest health information explained in plain language, subscribe and hit like. It helps more people find this channel, and the target is 300,000 subscribers. Today we are going through 7 signs that your blood pressure may be dangerously high. Not the obvious signs, the subtle ones. The ones that most people over 65 are experiencing right now and attributing to aging, stress, bad sleep, or simply getting older. Some of these will surprise you. Let's begin. Why blood pressure changes after 65. Before the 7 signs, you need to understand what is happening inside the vessels themselves, because that context makes every sign make more sense. Your arteries are not rigid pipes. They are living tissue, layered with smooth muscle that contracts and relaxes with every heartbeat. In a younger, healthy vascular system, the arteries absorb each pulse wave like a soft rubber tube. The pressure distributes evenly. The heart doesn't have to work too hard. After 65, that changes. The arterial walls stiffen. The elastic fibers that used to stretch and absorb each pulse gradually get replaced by stiffer collagen. The vessels stop cushioning the heartbeat and start reflecting it. The result is a harder, higher pressure wave traveling through the system with every single contraction. This is why isolated systolic hypertension, where the top number is high but the bottom number remains normal or even low, becomes increasingly common with age. The stiff pipes can't absorb the pulse. The pressure spikes at each beat. At the same time, the kidneys, which regulate blood pressure through fluid and salt balance, become less efficient. The baroreceptors, the pressure sensors in major vessels that help stabilize blood pressure moment to moment, become less responsive. The whole regulatory system becomes less precise, and blood pressure becomes harder to keep in a healthy range. The target numbers matter here. For most adults over 65, clinical guidelines suggest keeping systolic pressure, the top number, below 130 millimeters of mercury. But many people in this age group are running consistently at 150, 160, even higher, without feeling a thing. And every point above that target is doing damage that compounds silently over time. Now let's talk about what that damage looks like from the outside. Sign 1. Morning headaches that sit at the back of the head. Most headaches are tension headaches. They sit across the forehead or the temples. They come with stress, dehydration, or poor sleep. People know these, and they know how to manage them. But there is a specific headache pattern linked to high blood pressure that is different in location, in timing, and in character. It tends to sit at the base of the skull, in the occipital region, at the back and bottom of the head. It's often present on waking, before you've had caffeine or stress or done anything to trigger a tension headache. It may ease within an hour of getting up and moving around. The mechanism is real. During sleep, blood pressure follows a natural pattern. In healthy individuals, pressure dips by 10 to 20% overnight. In people with poorly controlled hypertension, that dip either doesn't happen or is blunted. Pressure remains elevated through the night. By early morning, the sustained pressure inside the cranial vessels produces a dull, heavy ache that is focused at the back of the head. Most people over 65 who experience this write it off as sleeping in the wrong position, or dehydration, or just one of those mornings. If this pattern is recurring, particularly first thing in the morning, and particularly at the back of the head, that is a reason to check your blood pressure before you do anything else. Sign 2. Nosebleeds that come out of nowhere. Spontaneous nosebleeds in older adults are common enough that most people dismiss them entirely. Dry air, thin nasal membranes, blood thinners, all valid causes. But elevated blood pressure is also a valid cause, and an important one to consider. The nasal passages contain a dense network of small, fragile blood vessels. When systemic blood pressure is significantly elevated, those small vessels are under increased stress. In some people, particularly when pressure spikes acutely, those vessels simply rupture. This doesn't happen with mildly elevated blood pressure. It tends to happen when pressure is significantly high, often in the 160/100 range or above. If you are experiencing nosebleeds that are not explained by dryness, trauma, or medication, and especially if they are happening regularly, measuring your blood pressure at the time of or shortly after the episode is informative. One nosebleed proves nothing. A pattern of them, in the absence of other obvious causes, deserves a proper blood pressure evaluation. Sign 3. Vision changes, floaters, or blurring that comes and goes. The eye is one of the most blood pressure sensitive organs in the body. The retina, the light-sensitive tissue at the back of the eye, is served by a dense network of tiny arterioles. Those vessels are so small and so delicate that elevated blood pressure damages them in ways that are measurable, detectable, and in advanced cases, visible to the naked eye through an ophthalmoscope. Hypertensive retinopathy is the clinical term for this damage. In its early stages, it produces no symptoms, but as it progresses, it can cause visual disturbances, intermittent blurring, fleeting spots or floaters, a sense that part of the visual field is slightly off. There is a more acute version of this that demands emergency attention. Hypertensive urgency and hypertensive emergency can produce sudden, dramatic visual changes, including temporary loss of vision in one eye. This is not a sign to wait on. But the subtler version, the occasional floaters, the mild blurring that comes and goes and never quite gets investigated properly, is often being driven by chronically elevated pressure that has been there long enough to affect the small retinal vessels. If you are over 65 and your optometrist or ophthalmologist has not checked your blood vessels at the back of your eye recently, that is worth requesting at your next eye appointment. Sign 4. Fatigue that doesn't match your activity level. This one is the most commonly dismissed sign of all, because fatigue in people over 65 is so easily attributed to age, to poor sleep, to a busy week, to anything except what might actually be driving it. When blood pressure is persistently elevated, the heart is working harder than it should with every single beat. It is pumping against a higher resistance. Over months and years, this forces the heart muscle to thicken and enlarge, a condition called left ventricular hypertrophy. The heart becomes less efficient at filling and emptying. Cardiac output drops slightly. The body's tissues receive fractionally less oxygen with each cycle. The result is fatigue. Not the dramatic exhaustion of heart failure. Not the acute tiredness after a sleepless night. A persistent, underlying tiredness that makes the afternoon feel heavier than it should. A sense that tasks which used to feel easy now require more effort. A desire to rest that doesn't fully resolve with sleep. Because this fatigue develops gradually over years, it rarely gets linked to blood pressure. People adapt to it. They adjust their activity. They assume this is just what 70 feels like. In many cases, when blood pressure finally gets properly controlled, they report feeling meaningfully more energetic. Not because they got younger, but because their heart stopped working at maximum effort around the clock. Sign 5. Difficulty concentrating and subtle memory changes. The brain is an extraordinarily vascular organ. It represents roughly 2% of body weight, but receives approximately 15% of cardiac output. Every part of that tissue depends on a constant, precisely regulated blood supply. When blood pressure remains elevated over years, several things happen to the brain's vasculature. The small perforating vessels that supply the deep white matter become narrowed and damaged. The blood-brain barrier, the tight seal that controls what moves from blood into brain tissue, becomes leaky. Microinfarcts, tiny silent strokes too small to produce symptoms individually, begin to accumulate. White matter lesions, visible on MRI as small bright spots, develop and multiply. Collectively, this produces vascular cognitive impairment. In its early stages, it doesn't look like dementia. It looks like difficulty holding on to a thought, needing to reread the same paragraph twice, walking into a room and forgetting what you came for more often than you used to, slower mental processing, a sense that concentration requires more deliberate effort. Because these changes are gradual, and because they overlap with many other causes of cognitive decline, they rarely get connected to blood pressure in clinical conversations. But the research is unambiguous. Long-term, uncontrolled hypertension is one of the most significant modifiable risk factors for vascular dementia. The brain damage is real, it is measurable, and it is progressive if the underlying pressure goes unaddressed. Sign 6. Shortness of breath with exertion that you've started avoiding. This sign requires some careful unpacking, because not all breathlessness with exertion is driven by blood pressure. Lung disease, anemia, deconditioning, cardiac arrhythmia, and heart failure all produce it. Blood pressure is one cause among many. But here is the specific pattern worth paying attention to. You used to climb a flight of stairs without thinking. Now you find yourself pausing at the top. You used to walk to the corner without effort. Now there is a subtle breathlessness halfway there. You haven't been formally diagnosed with any lung or heart condition. You have quietly, without fully deciding to, started doing slightly less to avoid triggering that breathlessness. When blood pressure is chronically elevated and the heart begins to hypertrophy and stiffen in response, a condition called diastolic dysfunction can develop. The heart has trouble relaxing fully between beats to fill properly. When demand increases during exertion, the system struggles to keep up. Pressure backs up into the pulmonary circulation. The lungs become slightly congested. Breathing requires more effort. The critical point here is the avoidance. When people start unconsciously limiting their activity to stay below the threshold where a symptom appears, they rarely label that as a symptom. They label it as being sensible, or taking it easy, or not pushing themselves. But avoidance is a sign. It means the body has already told the brain, quietly, that something is not right. Sign 7. Pulsing sensations in the ear or neck. This is the most anatomically specific sign on this list, and for many people, the most alarming when they finally pay attention to it. Pulsatile tinnitus is the term for hearing or feeling your own heartbeat, typically in one or both ears, sometimes in the neck. It presents as a rhythmic whooshing, thumping, or pulsing that syncs with the heartbeat. It tends to be noticeable in quiet environments, particularly when lying down at night. Several causes exist for pulsatile tinnitus. Vascular abnormalities, anemia, and thyroid conditions all produce it. But chronically elevated blood pressure is one of the most common drivers. When arterial pressure is high, the turbulent blood flow through vessels near the ear and skull becomes audible or perceptible as a physical sensation. The vessels are essentially transmitting the pressure wave to surrounding tissue, and in the quiet of the night, that signal becomes detectable. Many people experience this for months or years without reporting it, either because they assume it's a hearing problem or because they are simply used to it. If you are experiencing rhythmic pulsing or whooshing sounds in the ears, particularly at night or in quiet settings, this warrants a blood pressure check and a conversation with your doctor. What to do with this information? Here is the practical direction. First, measure. A single blood pressure reading at a doctor's office, taken when you are anxious, rushed, or have just walked in from a parking lot, is unreliable. Home monitoring with a validated cuff is the gold standard for understanding your real baseline. Measure in the morning before medication and food. Measure in the evening. Record the numbers. Bring them to your next appointment. Second, ask specifically about your pattern. Not just whether your blood pressure is high today, but whether you are consistently running above 130 systolic. Whether you are a dipper, meaning your pressure drops normally at night, or whether you are a non-dipper, which carries significantly higher cardiovascular risk. Third, understand that lifestyle changes are not decorative. Sodium reduction, meaningful and specific. Regular physical activity, even walking 30 minutes most days. Weight management. Alcohol reduction. These are not polite suggestions. They are interventions with quantifiable blood pressure effects. A reduction in sodium intake of 1,000 milligrams per day, which is entirely achievable, can lower systolic blood pressure by 5 to 6 points in people who are sensitive to sodium, and older adults are disproportionately salt sensitive. Fourth, if medication is indicated, take it consistently. The evidence for antihypertensive therapy in people over 65 is among the strongest in all of preventive medicine. The SPRINT trial, a major clinical study, showed that intensive blood pressure lowering significantly reduced cardiovascular events and death in older adults. Medication is not a fallback. For many people over 65, it is the most important single thing they can do for cardiovascular longevity. The red flags that require emergency care right now. Before you close this video, you need to know when elevated blood pressure stops being a chronic management problem and becomes an emergency. If you experience any of the following, call emergency services immediately. Do not wait to see if it passes. A sudden, severe headache unlike anything you have experienced before. Sudden blurred vision or loss of vision. Chest pain or pressure. Difficulty speaking or understanding speech. Weakness or numbness in one arm or leg. Sudden loss of coordination or balance. These are signs of hypertensive emergency, stroke, or acute cardiac event. Blood pressure at these moments may be 180 systolic or higher, and the damage to target organs can be occurring in real time. Time is tissue. Every minute matters. What you can do starting now. Write down which of the 7 signs you recognized in yourself. Not to frighten yourself, but because that information is useful and your doctor needs to hear it. Get a home blood pressure cuff if you don't have one. Measure consistently. Record the numbers. Ask your doctor at your next visit to specifically review your 24-hour blood pressure pattern and whether your cardiovascular risk profile has been evaluated recently. Start with sodium. Look at what you're eating. Processed foods, canned soups, deli meats, bread, and condiments are the largest sources of hidden sodium in most diets. Small, consistent changes add up. The 7 signs we covered today: morning headaches at the back of the head, spontaneous nosebleeds, visual changes, unexplained fatigue, subtle cognitive changes, exertional breathlessness you have started avoiding, and pulsing sensations in the ear, are not a checklist of catastrophe. They are a map, a set of signals that taken together tell you where to look. The information in this video is for educational purposes only. Before acting on anything here, please discuss it with a qualified healthcare provider who knows your individual history. If this gave you something worth knowing, subscribe and hit like. That's how this channel reaches more people, and 300,000 subscribers is the target. Thanks for watching this video.